Post-COVID-19 syndrome, or long COVID, as it is commonly called, describes the effects of COVID-19 which persist for weeks or sometimes months after a person was initially infected with the disease. Last year, the Health Ministry established a long COVID-19 unit at the Georgetown Public Hospital to provide treatment and support to those persons still experiencing symptoms of the disease long after they recovered. Health Minister Dr. Frank Anthony, during Monday's COVID-19 update, noted that there has been few persons visiting the unit for treatment.
We are spending a lot more time now focusing our attention on the rehabilitation of these patients.
Minister Anthony further revealed that with emphasis being placed on the rehabilitation of long COVID patients, a training session for local medical practitioners to equip them to better deal with long COVID patients will be rolled out next month.
In June, the first week of June, we'll have a training for physicians, a lecture that would be done by one of the top experts at Mount Sinai, and this would be done for Guyanese physicians.
He underscored that the objective of the training is to allow medical practitioners to become more familiar with and detect the syndrome and better provide treatment and care to those persons experiencing long COVID. Meanwhile, the subject minister, while disclosing that plans are in place to protect Guyana in case of future pandemics, highlighted that the government is working with international health agencies, including the World Health Organization, WHO, and the Pan American Health Organization, PAHO.
We recognize some of the challenges that we've had with COVID, so we would have had to build surveillance capacity so that we can detect the disease, laboratory capacity so that we can diagnose the disease.
85.9% of the adult population have received a first dose of a COVID-19 vaccine, while 66.3% have accessed double shots. For the adolescent cohort, 47.4% are partially vaccinated, while 34.7% are fully jabbed. To date, there are 63,664 adults with booster doses. Reporting for the HB 90 News, Joel Vogt.